would like to invite the senior occupational therapist of Lady Ridgeway Hospital, Mr. Chandana Pereira, to talk about evidence-based practice in cerebral palsy in occupational therapy.
In my presentation, I divide this to two parts. One is the early intervention of occupational therapy. Second one is the after 2 years later stage, how to manage the cerebral palsy using occupational therapy techniques. There are some research article that early intervention of children age 0 to 2 years. In here, there are 9 domains mentioned. Under these 9 domains, as occupational therapists, we use motor functions, cognitive skills, and some part supportive for eating and drinking, and vision rehabilitation. Under the motor functions, there are special thing is how to positioning, how to be the positioning according to their severity. Here, we want to improve their hand to get the midline and provide psychological stability and child's comfort, as well as prevent shoulder protraction. Because when shoulder is deviation, it is harmful to the further development. First thing is the how to get the child position, the supine position. Here we use foam or towel roll under the knees and supportive cushion or firm pillow for the head. This is easy to meet the infant's medical needs and facilitate visual discovery of the infant. The infant's knees and hips should be in the right flexion to the abdomen and the feet in this border. The elbow should be on the flex side of the body. The head should be on the midline or on the side where the infant feels comfortable. I'm not going to give any more details for this because early stage supine position is more important. And next thing is the how to position the sideline. Here we use manipulate long foam roll to the desired shape to the support back. Right. We use long foam or roll in their back side. This is facilitate to the hand get to the midline and hand to mouth contact development very easy when we put child like this way. In LRH, we use this type of form, and given these type of activities, how to get the hand midline, as well as sometimes hand get to the mouth. And if child unable to sit properly, we use get assistant their mother and keep like this way to long sitting. There are some video. Here we use improve their shoulder protraction as well as above level of the reaching. Still he is reaching below 90 level of the shoulder. Another position is the 4-point kneeling. Always all the activities you see like a play. Without not having child's motivation, we cannot get full results. Always we use play activities. Another thing is the visual training. Because children with CVI, 1 into 10 children with CP have severe vision impairment or blindness. We use CVI friendly environment at the home and do the activities. And when child facilitate to eating and drinking, we have introduce correct posture to support the feeding and drinking. Cerebral palsy OT intervention after 2 years. As previous presentation also mentioned that this is a traffic light method. There are green circles, most effective treatment methods. About treatment methods, we use CIMT, that means constraint-induced movement therapy, as well as bimanual hand training and goal-directed training, most related to occupational therapy. CIMTs increase the amount of use of the affected limb and improve quality of the use of the affected limb for the functional activities. This is effective treatment for the children who have developmental discharge and who have impaired strength, impaired sensation, and impaired motor control. We use two types of splint. One is the constraint splint that is used to unaffected side, and another one is the cock-up splint that is used to keep proper position, maintain the proper position for wrist. Another example for CIMT. At the early stage, the child not using their affected side, always use unaffected hand. Now he's engaged with this hand. Another one is the hand-arm bimanual intensive therapy. This is more used to improve their self-care activities. There is the chief arm used to support for affected side to improve their daily functions. Age between 18 to 16 years. Hand-arm bimanual intensive therapy is improved daily function of the children with bilateral cerebral palsy. This is the another research article. Another thing is the goal-directed task. This is involves a specific practice of child set goal using motor learning approach. This is outcome measure using goal attainment scale. The goal attainment scale, there are two negative parts as well as two positive parts. Expected outcome, more than expected outcome, and most favorable. And on the other side is the less than expected, most unfavorable. This is the cesarean skills training. Now she's initiate the scissor. As I mentioned earlier, when we got the traffic light, another thing is the occupational therapy after giving botulinum toxin. In this child, fingers are working, but when he's grasping, his wrist going to more flex position. This is the small size of cylinder. In this one, the wrist going to more flex position. When we give the weighted one, always it goes to the flex position. So, Madam gave the Botox, flexocarpi radialis, flexocarpi ulnaris, and pronator teres. As well as at the same day, we apply the cock-up placement to maintain the wrist position. Right. After giving the Botox and splint, he is able to maintain their wrist correct position and grip well. Okay, thank you very much. Give this opportunity to
දරුවා එකමදේ නැවත නැවත කිරීම, සෙල්ලම් බඩු එක දිගට තැබීම, ඕටිසම් තත්ත්වයේ ලක්ෂණයක් විය හැකි. ඕටිසම් ලදරුවියේදීම හඳුනාගතහොත් හොඳින් පාලනය කළ හැකි. නොපමාව අමතන්න 117.493 SLACD සහ CDB සාමූහික මෙහෙවරක්.
If your child focuses on things in a repetitive or obsessive way, it could be a sign of autism. Autism can be successfully managed if identified at an early age. Call our helpline on 0117490000, a joint effort by the SLACD and CDB.
மீண்டும் மீண்டும் ஒரே செயலை செய்தல், விளையாட்டு பொருட்களை ஒரே வரிசையாக அடுக்குதல் ஓட்டிசத்தின் அறிகுறியாக இருக்கலாம். ஓட்டிசத்தை சிறு வயதிலேயே இனங்கண்டு கொண்டால் அதனை கட்டுப்படுத்தலாம். தாமதியாது அழையுங்கள் 0117 490 0000. இது SLACD மற்றும் CDB இணைந்த செயற்திட்டம்.